Hi, good morning everyone. My name is Marvin, and we're here to present to you our case presentation on behalf of Team 6 regarding a study on Oakwood Village. First, let's introduce the members. Speaking myself, Marvin, there's Babita, Jaspreet, Amandeep, Tarunay, and Curly. Here is our definition of terms, and here is Girly to report on it.
Hi, I'm Girly Nell and I'm a member of Team 6 and in charge of the definition and population. Definition of terms. Alzheimer's disease, a degenerative brain disease of unknown cause that is most common form of dementia that usually starts in the late middle age or in old age. That results in progressive memory loss, impaired thinking, disorientation, and changes in personality and mood. And that is marked histologically by the degeneration of brain neurons, especially in the cerebral cortex, and by the presence of neurofibrillary tangles and plaques containing beta amyloid. Confused, disoriented with regard to one's sense of time, place, or identity. Dementia, a usually progressive condition, such as Alzheimer's disease, marked by the development of multiple cognitive deficits, such as memory impairment, aphasia, and the inability to plan and initiate the complex behavior. Depression, a mood disorder marked especially by sadness, inactivity, difficulty in thinking and concentration, a significant increase or decrease in appetite and time spent sleeping, feelings of dejection and hopelessness, and sometimes suicidal tendencies. Empathy, the action of understanding, being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experience of another, either the past or present, without having the feelings, thoughts, and experience fully communicated in an objectively explicit manner. Hallucination, a sensory perception, such as visual image or sound that occurs in the absence of an actual external stimulus and usually arises from the neurological disturbance, such as associated with the delirium tremens, schizophrenia, Parkinson's disease, or narcolepsy, or in response to drugs.
Hello everyone, my name is Babita Gill and I am going to present nursing considerations and assessment tools. Thank you. Oakwood Village presentation. Senior couple living in Oakwood. Case scenario. Senior couple living on a small pension with no family. The wife reports that her husband has been confused hearing voices and wandering out of the house late at night. Nursing concentration. A couple whose only income is their pension is having some problems. The wife reported that her husband has been confused, hearing voices, and wandering out of the house late at night, which could be the symptoms of early stages of dementia and Alzheimer's. Confusion in the elderly patient is usually a symptom of delirium or dementia, but it may also occur in the major depression or psychosis. Until another cause is identified, the confused patient should be assumed to have delirium. Wandering and becoming lost is common among people with Alzheimer's diseases or other disorders causing dementia. This behavior can happen in the early stages of dementia even if the person has never been wandered in the past. Dementia causes changes in the brain that may cause someone to hallucinate, such as to see, hear, feel, to, or taste something that is not there. Their brain is distorting or misinterpreting the senses with an hallucination. The most important is to validate an older adult's experience, respond to their feelings, and keep them safe. Determine if response is needed. Stay calm and don't argue or try to convince using logic. Validate their feelings and provide reassurance. Check the environment and remove possible triggers. Offer simple answers and reassurances. Look for patterns. Distract and redirect. Get support to help you cope. Talk with the doctor. If their safety or yours is at risk. Returns home after a walk or drive later than usual, nervous or disoriented in crowded places outside the home, has trouble finding familiar places such as the bathroom, bedroom, or their own home.
Here are some steps that we can take to help manage wandering. Keep doors shut. It goes without saying, but keeping exterior doors and windows closed will help keep them safe. Hide the keys. A person with dementia may not remember that they're not supposed to drive. Don't give them access, especially to car keys. Plan activities. Create a routine that includes exercise and activities such as art therapy or music therapy. It helps reduce stress and agitations. Keep food and water accessible. They may wake up in the middle of the night to eat and get up disoriented. Leave water bottle and some crackers where your loved one can find them. Alarms and monitors. In addition to hanging bells on front of the door, there are devices that help prevent wandering, including motion detection alarms. And here are the assessment tools. The Nicham Confusion Scale. This tool is used to measure levels of confusion in processing behavior and physiologic control. CAMP, or Confusion Assessment Method Instrument. It helps identify individuals who may be suffering from delirium or an acute or confusional state. This tool is used for distinguishing between delirium and dementia. Neuropsychiatric Invention, or NPI. 12 items to evaluate frequency and severity of following symptoms, including delusion, hallucination, agitation, depression, dysphoria, anxiety, euphoria or jubilation, and apathy or indifference, disinhibition, irritability, lability, motor behavior without a purpose, sleep alteration, and eating disorder. This tool is used to assess behavioral and psychological symptoms in patients with dementia. Lastly, the Diagnostic and Statistical Manual of Mental Disorders, or DSM Class 5, Classification and Diagnostics Tool for Mental Disorders.
My name is Amandeep Kaur and I'm going to present the strategies and the programs. Thank you so much. Strategies. Be patient. Do not interrupt. Be connected. Verbal cues. Offer comfort. Show respect. Avoid distraction. Keep it simple. Offer choices. Use visual cues. Avoid criticizing. Take breaks. Resources and external partner, brain health programs, day programs and respite care, art and music therapy. Resources and external partner, first link, public awareness, safety services.
There are many ways healthcare can build trust with patient. Building trust and rapport with patient is one of the most important aspects of a nurse's role. Nurses who take the time to establish a positive relationship with patients will gain a better understanding of the patient's needs and emotion, enabling them to deliver the highest level of care. Communication is the foundation on which you can establish trust with your patient. Introduce yourself and call the patient by their name. Eye contact. Communicate is often and well effective. Dress professionally and appropriately. Nursing scrubs are a symbol of authority and esprit. Make sure your nursing uniforms are clean and well maintained. Express empathy. You need to be able to empathize with your patient without being emotionally overwhelmed yourself. You will be the patient's first point of contact for all the queries, concerns, and call for help. They need to feel that they know you and that they are receiving personalized care. Show your patient that you are listening. When your patient is talking to you, make eye contact and listen actively by asking follow-up questions to find out more information. Pay attention to your body language. Be honest and keep your word. Show respect to your patient and all the time and start making changes today. Make sure that you act with honesty and integrity at all times. Both patients and their families appreciate honesty even if what they hear is hard to accept. Avoiding making false promises and keep your work. Show respect for your patient at all times. As a nurse, it is vital that you help the patient to manage their experience with a little distress as possible, showing respect for their privacy, well-being, belief, and opinion. Start making changes today. A positive nurse-patient relationship is vital for ensuring a high standard of healthcare. Nurses meet patients at the time when they are feeling anxious, vulnerable, and often in a degree of pain or discomfort.
Hi, my name is Marvin, and here is my report about what are the local resources available for the couple that they can access in their specific situation. Before we dive into that, here are the initial action the couple can take. Being part of Ontario's healthcare system, they can call their primary physician and bill it through OHIP, the Ontario's healthcare plan. Their doctor then will assess them and refer them to necessary specialists like their geriatric doctor or psychiatrist. But what exactly are the available resources they can go to? I have found that there is a community health service called Reconnect. It has a team of professionals that are capable of helping the couple with regards to the husband's mental health concerns. They include services like social work, nursing, occupational therapy, behavior therapy, geriatrics, and geriatric psychiatry. Although there is a criteria that they have to be eligible with, such as age over 65, mental health concern, and their location. The community prioritizes people living in the west of Yonge Street, but Oakwood is in the boundary of Toronto Central, which is part of their priority as well. They can also go to Seniors for Seniors Toronto. They have a program called Alzheimer's and Dementia Care. They are trained and experienced in Alzheimer's and dementia and cares for evolving behaviors of clients and manages evolving behaviors, providing cognitive stimulations and promoting social engagement. For other programs and agency the couple can access, they can also go to Alzheimer's Society of Ontario, which is 4.2 kilometers east of Oakwood Village, a 9-minute drive. Hi, my name again is Marvin, and here is our subsidies. What are the couple's options? Number 1. Canadian Mental Health Association, which was established in 1952. Its purpose is to provide help and support to local residents in their mental health and addictions. It serves 500,000 Ontario residents annually through 30 local branches. Number 2. The Mental Health Act. It is the act in Canada which defines what happens if someone facing mental illness is seeking treatment. Each province has its own chapter of mental health. 3. Disability tax credit. The couple can ask for disability tax credit. For persons who are disabled, they can ask to reduce their income tax. Some people with mental health can even ask tax credit to reduce their tax. Now, we'll give you to Girly to discuss about populations.
Population is 21,210. Female is 52.5% and male is 47.5%. Median age is 40.9, mean age is 41.3. Children 15%, youth 11%, working age 45%, pre-retirement 12%, and seniors 17%. Immigrants 47.5%, recent immigrants 7%, non-permanent residents 3.5%, second generation 28.5%, visible minority population is 43.1%, Aboriginal identity 1.2%, and Canadian citizens 83.9%. Mother tongue not English is 46.4%, home language not English 28.3%, less than one language spoken at home 23.8%, no knowledge of English 6.5%. Private households 8,685, household size 2.41, married is 41.7%, one-person households 30.6%, seniors living alone 31.8%. Renter households 47%, ground-related housing 82.5%, more than 5-story apartments 17.4%, unsuitable housing 12.5%, unaffordable housing 36.7%, inadequate housing 10.2%. Median household income is 58,216. Median family income is 77,522. Without income is 4%. Income from government transfer is 14.2%. Poverty 20.6%. Low income 18.6%. And 15.8%. Bachelor's degree or higher 37.1%. Unemployment rate 6.8%. Participation rate 65.7%. Full-time, full-year workers 49.5%. Public transit work 48.4%, and less than 1 hour commuters is 14.2%.
Please stand by as we show you the links of our references. Thank you. And that's the end of our video presentation. Thank you for watching and learning with us. Have a great day.